some of these instruments we went over before. I'm just gonna go over them again, okay? But we'll continue with some new ones. Okay, the first one we went over earlier was the vein retractor, okay? Now, what a retractor does, it gives exposure. So if you're in a wound, you can expose vital organs so that you can work. This is a vein retractor. They would use this probably on the ureters or delicate structures to move them out of the way. So the vein retractor. The next retractor is the Sen rake, okay? Now, as you can see with the Sen rake, it's a rake, it has sharp, and some Sen retractors have a blunt end, but this has a sharp end, okay? And also it has another retractor on the end, so depending on where you are, if you need a deeper retractor, you can use this end, or if it's shallow, you can use the rake, so the Sen retractor. The next retractor, the Army Navy, right, as you can see with the Army Navy, the shallow and the deep end, depending on where you are. If you're in a wound and you want to get deeper exposure, you flip that around and you can get better exposure. So the Army Navy retractor. The next one, everyone hopefully remembers what this one is. This is the Diva retractor. This is a big abdominal retractor. If they're working around the liver, they make this big exposure. They need to get in to move the liver away so they can get to the gallbladder and do the surgery there. So again, the Diva retractor. Another one is the Richardson. This can go by a different name. Sometimes they just call it an abdominal retractor. Sometimes they might say I need a 1x1 or a 2x2. What they're saying, you know, the size of the blade. Okay, you see, this is a double-ended. So again, you have the deep end, the shallow end. These are handheld retractors because you have to hold them in place, unlike a self-retaining retractor that you can put in place, lock it in place so your hands are free. But these are handheld, okay? So the Richardson retractor. All right, this next instrument is the knife handle. What I like about this, it has the number. So this is the number 3 knife handle, okay? So what a surgeon needs is a disposable blade that he locks onto the handle. When he puts that blade on, now this becomes a scalpel, okay? They use this to make an incision, okay? So this is a number 3 knife handle. The next one again is the number 7. Again, the 7 is on the instrument. It's a long, thin handle, so that they're working in the throat, they can get down and do the incision that way. Again, remember, once they put on a disposable blade, it's called a scalpel. Now, hopefully these blades, they're sharp. They should not make it their way to central processing, okay? These blades should be taken off and disposed at the point of use, okay? So in central processing, you should never see a blade, but just be careful when you're reaching into the pan. There might be a blade exposed. It might be sitting up, but they should not be, that shouldn't happen. But the number 7 knife handle. Moving a little bit into the forceps, okay? This is an Adson tooth forceps. If you look close, it has this fine tooth, and so actually you can use it to grab tissue, okay? Now the Adson forceps, the tissue they would use is the skin. They make an incision, they grab the skin. See how small it is? So it doesn't really cause that much damage to the skin. This is an Adson tooth forceps. They have Adson smooth forceps as well. So just so you know, all right? As we get into this one, this is a heavy tooth or tissue forceps. Okay, now just remember, these instruments can be different lengths depending on what part of the body you're working on, okay? And it has this rat tooth, again, you grab, okay, with this forceps, heavy tooth. Okay, this is if you're working on way deep into a cavity, okay? They have some that are maybe 5 inches. So the heavy tooth forceps. You know, I don't have a dressing forceps with me, but just like with this heavy tooth or this tissue forceps, it wouldn't have the tooth, okay? It would be smooth, okay? It would be used if you want to just move things and not to grasp things around, okay? The DeBakey forceps. Now this was named after Dr. DeBakey. He was a cardiac surgeon, right? And it's a really nice forceps when they're working on the hard or really delicate structures, the DeBakey forceps, okay? Now, if you see this is tape here. This is instrument tape. What they use is sometimes to identify instruments into certain groups. So the cardiac surgeons might have black tape, where the neurosurgeons might have a blue tape, but it just identifies what service the instrument belongs to, okay? Now, a part scissor, I don't have a part scissor. That's more of a specialty scissor. It's a right angle. They would use that scissor on, maybe if they're working on the gallbladder and have to make an incision into the gallbladder to take stones out and that sort of thing. All right. The next scissor is the curved Mayo. You can see this is a pretty heavy-duty scissor. You can see the curve, okay? They use that for if they're working on muscle or tendons and strong structures, the curved Mayo. Again, remember there can be different lengths depending on where you're working in the body. Okay, the straight Mayo, again, sometimes they may call this the straight Mayo, or they may call it a suture scissor, okay? Now this scissor is used for sutures. Now in surgery, if it's time to close up the body, they will put sutures in it. They have to cut those sutures. Or this can be used to cut dressings and sponges, okay? So the straight Mayo scissor. A big winner, a big one is the Metzenbaum. This is a small one, again, depending on the part of the body. It could be longer, but it's still a Mayo scissor, okay? So this is a Mayo scissor. A mosquito, now this is a clamp, okay, a mosquito clamp. Again, once they make that incision, right, you're going to start bleeding. So they need a clamp to clamp those bleeders, stop them from bleeding so they can tie them or coagulate them, so they need them the bleeding to stop. So this is a mosquito clamp, okay? This one, the Babcock clamp, it's atraumatic. They use this on the ovaries, or the ureters, things like that they don't want to perforate, okay? Again, it's atraumatic, all right? So they're able to delicately hold tissue without perforating or destroying it. The next one is the Kelly clamp. You know, sort of like the mosquito, but this is heavy duty, you know, ligaments, tendons, the uterus. There's ligaments that attach the uterus that they need to clamp off if they're doing a hysterectomy. So this is a clamp that they would use, okay? The Kelly clamp. The Coker, again, another one. See that tooth? All right, if they want to grab heavy tissue, clamp onto it, okay? If you look at the teeth here, and the heavy tooth forceps, they're identical, okay? The Coker clamp. The next one, the Alice, okay, again, okay. See, if as you look, see, from the instrument's the same here. This is where they change. This is where you need to. This is what makes it what it is, okay? The Alice, the Coker clamp, all right? The next one is a right angle clamp, okay? If they're trying to get around and do some work, they might have to get behind things, so that's what that right angle allows them to do, okay? If they're trying to get around and maneuver, they ask for the right angle clamp. Another scissor, again, is the tenotomy. They would use this scissor for fine dissection. Sometimes it's plastic surgeries where they're doing cosmetics. If they're working around the eye, they can use a fine scissor to dissect out, okay? The cryo, I don't have the cryo with me, but let me get you the mosquito clamp and the Kelly. So the cryo would be right in between these two, okay? So the Kelly is just like a bigger clamp, all right? So it would be the mosquito for clamping off vessels, the cryo, and then the Kelly for bigger vessels. So these are the instruments that we did today, and looking forward to seeing you soon.